Hello. Question.
We'll go on. We'll get to that question in just a minute, Graham. Hang on a second. All right. Torque and intrusion. Again, we'll go into other things in future webinars, but this is a real cool one to understand what torque and intrusion is. Torquing is a twisting motion. So if you're taking an upper incisor and you can twist it to the lingual or twist it to the labial, that's what you want to be able to do to torque. It is influenced by the teeth next to it. So it helps to have the AI to be able to say, if we move this one this way, the other one's going to go this way, and how do we handle that? Same thing with intrusion and biomechanics. We won't go into mechanics today, but I'll show you some examples about what we can do for them. These are representative of articles in our literature that talks about where the center of resistance is. And the center of resistance is which way the teeth move around that point. So if you're at 40% of tooth resistance, you then plan your mechanics at 40%. If you're 33%, if you're 25%. So these are great, but they don't take into account individual teeth. They take a pool of all these teeth, 1,000 cases, and we've decided that this is where we feel like the biomechanics are. It doesn't quite work that way because just as we are not all equal, our teeth are not all equal, and they're all different sizes and shapes. Look at these characters. The Rock, all these actors, Chris, Will Ferrell, they're all different body sizes and shapes. And if you push on them at the same point, that's not their center of resistance. That's an average of center resistance. So look at that. Where are you going to push? Same place on every guy? I don't think so. Just wouldn't get the same results. So think about that when you see these teeth. And 3D Predict can do this on every tooth. So center resistance for Will Ferrell, that's his tooth for every tooth in his body. That's not the case. Every tooth has a different root length. Every tooth has a different anatomy. And so with the AI that 3D Predict is using, you can now program it into each individual tooth. All right, so what is torque? We talked about that twisting, turning movement to get the crown and the root to go in opposite directions. 3D Predict can give you 30 degrees of torque without anything extra. So they're able to do it with direction of force. When you get your plan back from the lab, you'll see these little purple buttons that you see on the right. They are not attachments. They're just torque controllers. and it's made in the software and the plastic design about how this is created. And you can talk to Marina, who is the head of the company, to explain more about torque correctors. But it's just one more pressure point on the tooth, trying to affect the position of the tooth depending on the center of resistance. We also have posterior bite ramps that add to this. So this is a very, very sophisticated appliance. Here's the torque of 30 degrees. Look at that before and after in 15 months, which is very hard to do with brackets, very hard to do with other clear appliances, but it can be done very predictably with 3D Predict and their use of artificial intelligence. And again, here's this anterior root tray, and you can map it out. And not only look at the anterior root torque, look at the spaces we're developing posteriorly. So 3D Predict allows you to do multiple movements in the same clear tray. So we're not just, oh, we're going to work on here, and now we're going here, and now we're going there. And so your trays are in there. And I don't know if you've had it, but I've had trays from other companies that give me 40 to 50 to 60 trays just in the first try. And now with 3D Predict and being able to divide movements into what is predictable and what's not, look at the posterior space that you're going about distalizing everything, which allows you to then tip and torque the upper incisors. But you know, this is just crazy. 28 trays. All your plans are reviewed by an orthodontist. You're welcome to talk to the digital lab and get some questions and concerns. But the initial and final are shown, and then on the right, the video shows you how everything's working. But look how nicely those teeth are moving distally, creating space, and now you're able to torque those upper incisors very nicely and very predictable. Once again, initial on the left, that's not a very healthy bony structure for your tooth. Putting it back, doing some lingual root torque allows that tooth to be covered in bone. And you can see on the video how the red just disappears. You get more bone coverage. All right, how about intrusion? Now, what are we really getting? So this is what you want to see. But look at your lip line of your patients. Do they want this? Will you bury the teeth into the lip? You want to make sure you show plenty of tooth. Everybody likes that big toothy smile. But this is something you get 3 millimeters of intrusion and root torque without any other specialty appliances. And we all love the newest and the latest, but TADS came in. We thought it was going to be wonderful. And it was just one more thing to put in your tool case that you really don't need using a more sophisticated AI-driven treatment. And once again, with the bite ramps, they really do help. All right, simultaneous movement. We're doing torque, we're intrusion, and we're doing distalization of the bicuspids and molars. We're doing some rotation, and then you get expansion at the same time. So with that simultaneous movement, your cases will treat faster and more predictably. And then some before and afters of cases we talk to you. And people see this pretty quickly. You know, it's not like we're waiting to go and waiting to go. It's all good. Just it's going continuously. Deep overbite on the left. You start the intrusion really nicely, and now you get nice alignment, what we call the anterior aesthetic plane. All those incisors are in a nice alignment. The centrals don't hang down too far. The centrals and cuspids are roughly at the same height, and the laterals are maybe 0.5 millimeter more gingerly to them. If I'm not mistaken, I think this is one of my cases that we treated this young lady with 7 months just by intrusion of about 1 millimeter. She didn't need a ton, but then we're able to do root torque, which gave you another 0.5 millimeter of intrusion along the way. But this is in, like I said, 7 months of treatment without a single refinement. AI is just spectacular. Here are a few other examples of intrusion. And again, look at the patient smiling. Stand in front of them. Get away from the way we've done things for years, is sit in a chair and look over their right shoulder and go, oh, I think we're going to fix this and do that. Let them stand up, do a facial analysis, let them know what you're saying. Hey, I see that your top teeth hang down too far. You see how you hold, you have too much gum in this area. And you know what? When you smile, you really only see your front four teeth. You don't see any back teeth. Let's get that included. Let's do some minor to moderate expansion. Let me get you this smile that you see on the front of the People magazine. And if you explain it to them, and then as you start developing your technique and your spiel, you'll start looking more and more yourself. You go, oh, now I see what Dabney's talking about. Let me get these teeth lined up. Let's look at the anterior aesthetic plane. Let's look at the buccal corridors, and let's see what we can plan. And then using the AI and 3D predict, it makes it so much easier than me putting braces on people and trying to manipulate it through wires and whatnot. You know, I just can't get this intrusion in my hands with brackets and wires. I mean, I can, but I can't do it in 6 months. And I was an initial plastic lover when it came out in 1980. And by 1981, I hated it. It couldn't do anything. It was a farce. And I'm not talking about any particular company, but just it wasn't that sophisticated. It was a great idea. But now with the use of AI, with the use of better materials and having more information, this is very achievable very easily. All right, any questions?
No questions from the chat.
Okay, I'll keep going. Maybe we'll finish up a few minutes early.
So I got a question for you.
Yes, sir.
So we do a good amount of Invisalign at our practices, 1,500 plus cases a year. I can get that kind of intrusion with the aligners that we use, but I wouldn't say it's predictable. So what makes these aligners more predictable than the aligners that I use? And I tend to find that ours they're not always stable. So can I get 2-3 millimeters? Sure. But is it stable for 2 or 3 years? Not always.
I think you need to look at your setup cases so you can get some intrusion, but if you don't have the lower anterior set up to help it stabilize, that may be an issue. I think also by going with the AI, they will get those teeth in better lingual root torque than you realize what you're getting now. And I don't want you taking an x-ray every time you see a patient to get a 0.5 millimeter and that type of thing. But we're seeing that with the material that the tray is made out of and with the AI and being more predictable, and it will hold up like we've shown you a few slides before. But you need to set up your case where you have the anterior stop so you don't get the continued overgrowth of the upper teeth, so that your teeth are, you had a deep overbite, now you don't have it, now you have it again. What's keeping it from being predictable is the position of the lower cuspid to cuspid and getting some anterior guidance and getting some definite stops on those teeth so they don't just continue to overgrow once you've gotten to it. Does that help you a tiny bit?
Well, I mean, the orthodontists that I work with seem to have the same issues using clear aligners that we do. I just don't consider 2 to 3 millimeters predictable and stable. How old were those patients that you just showed?
I have some that are preteen on up. The ones I've been using lately that I show in these presentations are in the 30 to 45-year-old range.
That's older. I mean, we definitely get it better with under 20 women more than men. We start getting over 40, 50, it just becomes less and less predictable.
Do you look
plus hasn't been good.
Do you look at facial types from the dococephalic or mesocephalic and that type of thing to see which ones you're getting better results on?
Yes and no. I don't, I oversee all the cases. So some cases don't always have photos. So I don't always see those 100% of the time.
I would definitely make photos part of your goal going forward to see everything.
It's one of my goals, but I got 17 doctors, so it doesn't always.
No, I feel for you. It's a big headache. Perhaps you could do a study to where you started with 1 or 2 of your doctors or 1 or 2 of your clinics and say, hey, the next 20 people, I want you to do 3D predict and we won't look at it. The thing I hate about orthodontics is you can do a beautiful veneer and put it in and see the results right away. With orthodontics, it takes 10, 12, 16, 18 months to see the finish. But I think if you'll do a subgroup testing, that you'll start seeing things not only more predictable, but more accurate because of the software.
So what makes your software and your plastic better than the major brand of software and plastic that I currently use?
Marina, I'm gonna let you answer that since you know the AI better than I do, because
Yeah.
I think that's the key to it.
Yeah, thank you, Dr. Brandon, for your question. I'll try to answer it. So I'm founder and CEO of 3D Predict. So plastic is pretty much the same. Our plastic is more rigid, but it's not a plastic thing. It's more about software which we use to design teeth movement. We see like no difference between different types of plastics. We tested different plastics, but it's pretty much the same. It's all about software. And why our software is different? Because we developed it based on thousands of patients which had root and bone-based treatment planning. So those patients which started like root and bone-based treatment planning like 5 years ago, then they completed treatment. And so it was some time ago. And then we just use this data set to train our algorithm. It's AI-based, machine learning-based algorithms to see what type of forces or what direction of forces will provide us more predictable treatment. How can we combine intrusion and, for example, lingual root talk to achieve more predictable treatment? For example, with like most of other systems, you'll do like the best system to do lingual root talk is lingual braces. But of course, lingual braces are very difficult to use, and like most of orthodontists do not use them. But for example, if you need to achieve intrusion on the lower arch, you need to combine intrusion and lingual root talk. And just because we started doing root and bone-based treatment planning 5 years ago, we already have patients who complete the treatment, and then we analyze this data set. So right now, our software just predicts the best method to apply forces to achieve intrusion and lingual root talk on a low arch, for example, and this makes treatment more predictable. So you can achieve more than almost like 3 millimeters of anterior intrusion in combination with like lingual root talk without additional appliances, without tats, without rubber bands. So just to answer your questions, the main difference is in software. Plastic is important, but not as important as software and how you predict forces and direction of forces, and for example, how much forces should be applied to incisor to achieve 15 degrees of root talk or 18 degrees of root talk. It's different. And how can we apply forces to aligners? By making them thicker or thinner. And so it's all about where do you place torque controller, attachments, and bite ramps. Even though all these 3 components are pretty much the same across different systems, it's the major question right now to achieve more predictable treatment. Where do you need them? Where to place them? At what size in relation to length of the root? Type of tooth movement should they be? Does it answer your question?
So you essentially saw I mean, we use Invisalign. You're saying that your software is essentially better than Align software.
It's more predictable. Yeah, it's different. They developed their software based on crowns only. We started with roots and bone, like treatment planning first, like 5 years ago, and it was a machine learning based software. So you're like, it's more predictable. So you can achieve like specific tooth movements with much less refinements and without additional appliances.
So do you need less attachments too then?
Yes, less. We still need attachments, but less.
Okay.
And Richard, if I heard your name correctly, I apologize if your name's not Richard. But I present
Brandon.
for different. Pardon?
Brandon, Dr.
Brandon.
Brandon.
I'm sorry, Brandon.
You're good. You're good, man.
Okay, I present for a whole lot of different companies, depending on time of day and time of my career and that kind of stuff. And I'm not employed at all by 3D Predict. I like what I'm seeing in my office. I'm starting to do more and more of them. People want clear plastic, but I'm also very big on efficiency, and I've been able to push out appointments further with using 3D Predict. I'm getting my cases finished sooner with their AI. It's just a whole new system. But like I said, I'm not an employee. My email will come up at the end. Ask you, please call me. Let's talk about some of these things, because each doctor has their own perspective. And I think a forum like this where people will open up and ask a question, it makes Marina and her crowd be able to explain their software better, explain why there are differences. But I'm seeing it in real time in my office so far. But yeah, please contact me. We can talk more. And if you've got issues about things not working quite the way they want, or a time appointment, that kind of stuff, because if you're dealing 17 dentists, you're seeing a ton of cases that I think Marina would love to help you with. And they're great staff. But like I say, mine is just a backup resource of someone who's been doing this for a while. And the rest of y'all, please feel free to reach out, because I'm not a company employee. I'm not going to tell you anything I don't like. But overall, when I started doing this, it's like, boy, these people are onto something special, because they're actually incorporating roots. And now some of the other clear aligner companies are trying to tell you they incorporate roots. And I still deal with some of them, but their systems are nowhere near sophisticated as these are. And I feel like that 3D Predict is more like the Ferrari, Mercedes of the car companies. They're the same thing with these clear aligners. They know what they're doing. They're just not throwing something out there without any technical research. And I encourage you to contact me, but more importantly, contact the company. It's a small company. They're right there willing to talk to you, with very little hesitation. And I've just been real impressed with the customer service, everyone. So please reach out. Anybody who's listening to this, reach out to the 3D team and say, I'm having a problem with this, or I don't think I have a problem, but I'm wondering how you do this better than other things. They're very, very, very helpful.
Thank you, Doc.
You're welcome. All right, this was not a tough case. She had some crowding. Upper teeth were lingually inclined, so we added some torque. But again, I kind of had to bite my lip when she finished it 9 months and 3 visits. My revenue per appointment was about $700 or so. And I can explain that stuff to you later. But it's kind of like, oh, maybe I need to give her a refund. This lady was ecstatic. So yeah, this is just typical of what we're seeing with the 3D Predict cases. Thin trays, 2 millimeters intrusion. This is also one that shows not only the amount of retraction and expansion, but also shows the amount of rotation on certain teeth. So you get a feel when you start looking in the mouth as to what will take, how much rotation is that? You can ballpark it. We're not going to measure 13 and a half, but you look at these cases and you start getting the feel. If you're a general dentist, maybe you don't know how to estimate how long things are going to take. And I'll tell you an inside secret, the damn orthodontists you work with, they don't know it either. And we're taking a guess. We're doing experience, we do some things, but every case is going to be different. So be careful when you tell somebody how fast it's going to be. But be realistic, give them a range, and it depends on how much they're going to wear these things as well. But yeah, you get some nice, very nice results with this 3D Predict software, especially in the trays. Some nice distalization. Hard for me to say that word even still. But look how far those bicuspids and molars push back. I'm so sorry I've hit a button that I didn't mean to. And this gives you an idea of how much you can intrude and how much you can rotate. And it becomes a ballpark issue after a while. But you look at these videos and you start seeing certain things. I took an art history class in college because I thought it was going to be easy. It was the hardest thing in the world because you had to go and look at these great paintings and say who did them, where are they in the museum, that kind of stuff. I had no appreciation. And sometimes as dentists, we don't have appreciation for how teeth move. But this picture shows you from the apical about how these roots are moving and how the space is going. And after a while, it becomes fairly intuitive for what goes happen. And this is just before and after of a CBCT. All right, Brandon, this is where 3D Predict gets into the nuts and bolts of your practice. When I do my cases with other clear aligner companies, I am doing 2 to 3 refinements easily per patient. And I still use that appliance, and I use 4 or 5 different manufacturers of appliances, just testing and checking and see what's going to benefit my patient most. But this gives you an idea that 3D Predict went through their studies and found that out of every patient, they don't only need 1 refinement, but out of 10 patients, 70% of them are going to need some refinements. So at each refinement, we typically have at least 3 more appointments. So you can get 21 extra appointments with 3D Predict. Ballpark $250 appointment, and I can teach you how to do 1.5 to 3.5 times that for appointments if you'd like. So your cost of refinement is an extra $5,000. Now let's go to a competitor that now you need 2.5 refinements, which you're going to need 3 extra appointments. Now you got 75 appointments, and the cost of all those appointments is $18,000. And you tell me which one works better in your practice, and which one not only works better financially, but which one will make your patients and your staff happier. And when you need to do some of this stuff, Brandon, take the last 10 to 100 cases that you finished up and just compare how many appointments you're seeing, how many times they've come back in for refinements, leave out the emergencies, and see what your revenue per appointment is. And I can help anybody with that concept as well, because it's kind of different in the orthodontic and dental world. But you need to look at this from an efficiency standpoint. It's what's going to get you from point A to point B the fastest, give you the best results, and overall save you some money with the cost of refinements. And that's a pretty big deal. And somebody who's doing 2 of these a month, twice that. So instead of spending 36,000, now you're going to spend 10,000. Definitely worth the extra expense, extra time of 3D Predict. But I think 3D Predict, and please feel free to call them, because they have specials, they have this, but the cost of aligners is not that much difference from coast to coast, depending on provider, depending on company. So there you go, another $13,000 in your pocket. Okay, so we've already talked about the amount of intrusion you can get, and it's very predictable movement. You'll see your patients less frequently, and I know, Brandon, I'll pick on you because you're such a wonderful person and have all these dentists working for you. It hurt my feelings one time when I came in and talked to my patients after going to a big conference and said, hey, I found this app that will allow me, instead of seeing you every 6 weeks, I can see you every 10, maybe 12 weeks. And I know y'all love me because I tell the best jokes in the world and like we all think that we're so wonderful, and we are. But each family said, you know what, if I don't have to come in here, I've got more time for violin lessons, soccer lessons, and the rest of it. So you want to be able to see these things finish up maybe a little sooner, certainly more predictable, and with less effort on your patient's part. And it doesn't matter where you are in dentistry and orthodontics. If you have some appliances on, if it's a 6 month case, it's 4 months ago, when am I getting these off? If it's a 30-month case at 24 months or something, they all want them off sooner. Just like we all want to get on vacation sooner and get and arrive at our destination sooner and more predictably, without any breakdowns, without any flight delays, without any, I hate to say it, lost luggage. All right, in the future, I hope you'll join some of our educational events. Yours truly gets to do about posterior intrusion. We'll talk about the different biomechanics and how this helps you develop a predictable diagnosis and treatment plan for your patients. And then the restorative advantages, because we've got a lot of people who are doing implants. We need to create space for that. And you can maintain all this in your office and under your rule and under your direction. And I think you'll be better off with your patients achieving the predictable results. Anybody want to come up with a topic? We'd love to see it. If no one wants to answer, I can make things up. Sophia is head of their educational program, and she is top notch, and she has got lots of different issues that we can explore in the future. And I'll let Sophia talk about that as she goes on.
Yeah, we really want to hear from you to actually cater to your needs. You know, we're not just an aligner company, we're a scientific company. So we want you to understand how our system works so you feel confident on it, because we know out there, there's not much information that is outside marketing. We're actually looking to break those barriers and talk your language, which is scientific dentistry.
And on top of that, Sophia, I speak to the reps of different companies, and I'm amazed at the number of reps once they're honest with me. And maybe yours will be the same thing about, oh, how many times do we go look at this? Or do you accept the first thing? And a lot of people, without the training and dedication that you folks have tonight, to really explore, understand, and deep dive into the science and the treatment methods for this, you know, they're just going, oh, hit the button. It's great. This works. It's like a cartoon. Well, sometimes it doesn't work. So these people are here to sell their product, of course, but they're also here to educate. And that's what I've been very impressed about the company in itself. All right. Yeah. I'll let you take over, please, Sophia.
So
Sophia, you're good.
please, yeah, thank you. I was just closing the poll. So here you have a QR code. Please take out your phone right now and schedule an intro to 3D Predict. So this meeting can be anything you want it to be. Like I said, we're here to support you. So if you want to learn more about our company, please schedule a meeting with us. If you want to start your first case, if you're ready to see, you know, what will be the base case to select with us, we can guide you on that process too. What we're looking for when we're talking about prescriptions. Do you need a CVCT? Don't you need a CVCT? And by the way, you don't necessarily need it depending on case. Please just get that QR code on your phone right now. Like I said, we are here to answer all your questions because we know how serious you are about your patients, and we're serious about your patients too. So we want you to feel confident before you start this journey with us.
Sophia, do you have my email up by chance?
Yeah, next slide.
Go right ahead.
You're still sharing your screen.
Okay, I'm going to stop. Okay, there you go. So listen, this is a joint effort, trying to help patients. I mean, I'm big into helping people. I've got a lot of experience. I don't have all the answers, but you know how when you were first or second year in dental school, when you were scared to pick up a handpiece and, you know, start that first occlusal prep, and you'd lean to your right or lean to your left, says, hey, how do you do this? What burr goes in here? Where's the foot pedal? Those are questions that we all have when we're starting new techniques. And we're, like I said, we're here to help everyone. So please reach out. I don't know all the answers, but I'll be happy to get you to someone who does. And sometimes it's a simple question and you just maybe a tiny bit embarrassed that you go, oh, I'm gonna look stupid and everybody else knows this, or how do I get this, or where do I get extra training? You know, so reach out and I'll help you when I can. The folks at 3D Predict will certainly help, and your sales reps are excellent people. They've got all kinds of knowledge. They've been well trained and they know where to look for the resources. So I tell my sales rep, I said, the way you can help me is give me more information, not just about your product, but how the lay of the land is. What are people doing? What are we looking for? Why is your product maybe a little bit better at this type of thing? And how can you work about the finances? And that's the big thing. It's how you get more efficient. And I'm not trying to become a multi-millionaire. I don't trade in Bitcoins, thank goodness. But there are ways that your friends and your classmates are out there to help you. Not every one of your classmates. I won't mention about a few of mine, but you know, most people out there are really willing to guide, and the questions you have maybe has never come up. And it's like, oh, I never thought about it that way. Thank you for bringing it up. Or others, it's like, oh, that's a simple thing to take care of. So really reach out to me, reach out to your orthodontist in the neighborhood, your friends next door, and certainly to all the wonderful people at 3D Predict.
Thank Thank you very much, Dr. Dabney. Do we have any final questions? Anything that you may want to ask, please? Dr. Caslow said it will be nice to have a webinar on different retention treatment.
And Brianna Jones, are you awake?
I don't think Dr. Brandon is on the call anymore.
Okay, I guess she's got a picture of that because I was going to ask her what she had. Never mind. Sorry to pick on you. And I wasn't picking on you. I was just trying to be engaging.
You're always engaging, Dr. Dabney. So any final comments, questions? Dr. Mustelier says, thank you for such an informative presentation. And absolutely, it's always great to have Dr. Dabney as a speaker. We're very fortunate to have him. So if we don't have any final questions, once again, please feel free to reach out to any of us. We're here to support you. We're here to answer your questions. We're here to help you with anything you need. Case selection, more information on biomechanics, how our company works, how our AI works, anything, we're an open book for you. So thank you very much and have a great evening.
Thank you. Thank you so much for joining us tonight.
Yes.
Thank you, Dr. Dabney, for amazing presentation. Thank you.
You're most welcome.
Bye.
Bye-bye.